Thank you for joining me today to learn more about the Virtual Doctor's Lounge presented by the Arizona Medical Association. I'm Juliana Stanley, ARMA's Director of Practice Support. Let's start by thinking for a moment what a physician is. According to Webster, a physician is a person skilled in the art of healing. Another phrase that we're familiar with is the proverb, physician, heal thyself. What does that really mean? Before physicians can adequately treat others, they must first heal themselves. In other words, you first need to fill your own cup before you can fill the cup of others. And that brings us to the physician's need for support. Physicians are under considerable strain, even under usual circumstances. The added emotional stress of responding to patients during the COVID-19 pandemic is putting you at exceptional risk. And physicians are experiencing a high degree of emotional burnout from the burden of responding to the crisis. And unfortunately, we're seeing increasing occurrences of substance abuse, depression, and even suicide. Distressed physicians often avoid seeking professional mental health assistance. Statistics show that between 10 and 12% of physicians have a substance use disorder, but those numbers are on the rise. The rate of substance abuse has increased over the past few years to 12.9% in male physicians and 21.9% in female physicians, and that was 5 years ago. 44% of physicians report experiencing some symptoms of burnout, and 28% of medical residents suffer from some degree of depression. Approximately 400 American physicians commit suicide each year, which is unfortunately, again, more than double the rate of the general population. Add the stressors of a global pandemic, like a lack of PPE and proper supplies, extended shifts and the physical fatigue that goes along with that, separation from your usual colleagues and family, altered standards of care and the ethical challenges that go along with that, the fear of getting the virus or infecting friends and family members. For those of you who are self-employed, the financial concerns that you have for your practice, your staff, witnessing the death of patients, and all of this boils down to a huge degree of uncertainty. The adverse effects of this stress and burnout can be lower quality of care, medical errors, longer patient recovery times, lower patient satisfaction, and a negative impact on your personal and family life. Unfortunately, physicians are often reluctant to contact internal support programs for help due to concerns around confidentiality and quality of services, as well as the fear that doing so will have a negative impact on their employment and their career. A 2014 survey found that nearly 40% of physicians would be reluctant to seek care for mental health due to licensure concerns. State medical licensing boards and employers that ask about mental health conditions versus current impairment further deter distressed physicians from seeking help. Institutional medical culture has stigmatized mental health conditions. Physicians tend to internalize distress as part of their personal and professional identity. Your training teaches you to work through a crisis, not stop and take care of yourself. Physicians may be most comfortable speaking with other physicians because you have relatable experience. So now, how can you get any kind of help that you might be comfortable with? ARMA is pleased to present the Virtual Doctor's Lounge. This program is being offered to all Arizona physicians and residents in partnership with ADHS and Access. So what is the Virtual Doctor's Lounge? This is a peer assistance program that's designed to provide informal, confidential, and peer-led support to physicians. Think of it as an actual doctor's lounge. When you're working in a hospital or another facility, you could go into a lounge for a break during a tough shift and vent to other physicians who are in there. Because you're all experiencing the same things, you can vent and you know you're not alone. you can relate to others, and you feel a little bit better, and you're a little more able to cope. The program connects physicians and residents with a trained physician peer coach who will provide remote and confidential coaching sessions at no cost to you. While it is not a substitute for therapy or medical care, coaching has been demonstrated to provide several benefits, including relief from emotional exhaustion and reduced levels of self-reported burnout. The virtual doctor's lounge is designed to reduce barriers to care and remove the perceived stigma by connecting peers in a confidential platform and in an informal setting. It provides physicians with easy and discreet access to trained peer coaches who can provide prompt consultation and short-term support to support peak performance for our individual physicians. Of course, physicians have concerns that are related to finances, human resources, and other business questions. We'll have resources available through the program as well as through ARMA. Corporate Counseling Associates, or CCA, has developed the Virtual Doctor's Lounge in collaboration with ARMA. They have 35 years experience working within mental health in the workplace programs, employee assistance programs, crisis response, work-life balance, learning and development, diversity, equity, and inclusion programs, as well as leadership and management development. CCA's team of licensed mental health professionals will provide coaching training to all peer volunteers, including explaining the parameters and limitations of the program, basic engagement and supportive coaching techniques. They'll teach you self-care and how to establish boundaries, how to manage high-risk concerns, and they're available for supportive and professional resources. And they'll also explain to you how to access immediate support from the CCA team if there's an issue you're not sure how to deal with. In addition to training, CCA staff will provide ongoing support and guidance to peer coaches and will assist directly with any higher risk situations. If you'd like to be a volunteer coach, you would need to be a physician licensed in Arizona, make a one-year commitment of up to 2 hours per week. Probably won't be that every week, but that would be the maximum. You would go through a brief screening to discuss program requirements and attend 3 virtual training sessions being held in September. Right now, we are in the first stage of our program launch. We're actively recruiting volunteer coaches, and that will go on through the end of August. The 3 training sessions will be conducted during September for the coaches, and then peer-to-peer connection will begin on at the beginning of October. If you would like to volunteer as a peer coach, or if you have other questions about the Virtual Doctor's Lounge, contact information is here. You can contact Jay Sandys, the CCA Vice President, Organizational Development. Email address is mdlounge@ccainc.com, or you can call them at 646-809-0957. You can also reach me, Juliana Stanley. I'm a Director of Practice Support at jstanley@azmed.org, or call me at 602-347-6919. We're very happy to bring you this program, and we hope that you'll participate and share this around because it's available to all Arizona physicians. Thank you.